Now we're Dr. Darien, and here's the question for the ER doctor right here. What do I need to know about cold-related illnesses?
This is so important. You know, wind chill and the freezing temperatures that we've seen across the United States. So many people are in the elements and not prepared for it. So I think the best thing you need to know is how to prepare. You want to make sure that you're wearing wind-resistant, water-resistant material. You're choosing wool over cotton, and you're being cognizant of the temperature. When it falls below freezing, that's when the danger starts. So you got to make sure you prepare early.
I just prefer not to go out there, but if you go out in the cold, you know, my delicate southern skin, how do you know when you're in trouble?
You know, it really is dependent on what your risk. The highest risk patients that I look to are those who are the youngest and those who are the oldest. Those are the most commonly associated with cold-related injuries. And then those who have chronic conditions, heart disease, diabetes, that increases your risk of cold-related injuries, often because you don't feel it. And then on top of that, what do you do when you're experiencing a cold-related injury or you're witnessing someone might be experiencing them? You obviously want to get them into a warm room, but some things you don't want to do. You don't want to overexert a person who might be suffering from cold-related injuries, because then that diverts blood to the muscles away from the heart and the important organs. You don't want to rub or massage areas that you might be cold-related, because that increases your risk of tissue damage. And you don't want to apply unnecessary heating pads to areas that you might be experiencing numbness, because that can increase your risk of burns.
So what's your advice for runners and those who like to exercise?
Prepare early, wear layers, and make sure that you know your path. And be careful of ice. It's the most common cause. It's not necessarily, or the most common cause of people coming in, not necessarily the cold, but falling. A lot of broken bones this time of year, a lot of head injuries because of, unfortunately, that ice is incredibly slippery.
You see a lot of cold-related injuries yesterday in the ER?
I saw a lot of falls, you know, a lot of falls, a lot of trip and falls. I don't know if that was congestion pricing or cold-related injuries, but it's one or the other.
Oh, no.
Yeah, we see it all in the emergency room.
Oh, goodness.